Hanif, you mentioned, I asked Sultana the question of the inequality and the disproportion numbers of BAME community. Now, you mentioned resources and local authorities, and of course, if there is such a disproportionate number of people from BAME communities which are being affected, will the resources and the provisions that are being given, will they be distributed in accordance with that, or is there likely to be, or which I suppose I'm asking the question I know the answer to already, that there will be inequality in the distribution of resources?
It's a good question, and one thing I can answer you back. Currently, we're having people dying in the hundreds still in the UK, and the government will be prioritising all their efforts to stop this from happening. That is what's on their mind, and how to curtail the spread of the pandemic. Now, many people have already asked the question, and from all quarters, the press and the opposition parties have said, we want to know why this is happening. Where is the data analysis? Are you going to do it? And they have agreed that they're going to do this. The results will come out. We do not know the answers. It might be as simple as vitamin D. We don't know. Is it that some people have an acceptance of vitamin D that may be the reason? We don't know. Is it because in our households we tend to find that more people live in that house? Therefore, how can you social distance in the house? What is that? So if you have someone who goes to the NHS or goes out, picks it up, they bring it home, then there's more people living in the home. How can they social distance? Is it because that most of the BAME community work on the front line? They're the shopkeepers. They are those that are collecting our rubbish. They are the street cleaners. But then again, we have many BAME who work for the NHS. Nearly, I think it's about 50% or more of the BAME community are employed by the NHS. So I don't know the answers to these questions, but in terms of funding, when this is over, when we've got a handle of it, all these questions will be investigated and answers will come through. And if it is a lack of resources, money, socioeconomics, you name it, then I would call upon the government to start spending money in those deprived areas 100%.
All right, Hanif, Jazakallah for that. Moving on, our next guest is with us on the line. Before we go to her, just a reminder for you, if you want to have your say, if you have any questions, any comments, then you can call us on 0208687778, or you can send us a comment on Instagram. Don't forget, we're asking you the question, should we have to fundraise for the NHS, on our Instagram story, or you can send us a tweet as well at Voice of Islam UK. Hanif.
So I'm looking forward to be speaking to Yvonne Coghill. She's CBE, OBE, MSc, D, but she's got many titles after her name, a very well experienced, wonderful practitioner. She started her career as a general nurse in the 1980s, specialized in mental health. I'm sure she'll correct me on some of this. But the most important thing is in 2004, she was appointed as the Department of Health as the private secretary to the chief executive of the NHS, Sir Nigel Crisp. And at the moment, Yvonne, she is currently the director of the Work Race Equality Standards, also known as RES. And that's an implementation from the NHS England. And she's also the deputy president for the Royal College of Nursing. And I probably could go on. But before I do that, let's welcome Yvonne to the Drive Time Show. Thank you for joining us today, Yvonne.
Hello. Well, good afternoon. Good afternoon, everybody. It's always interesting to hear when people talk about your biography, actually.
Did we leave anything out? I'm sure Hanif did.
Did we mention this is your life?
It's a bit like that, actually. Thank you. Thank you so much.
Thank you for joining us today, Yvonne. It's great to have you on. Hanif mentioned about the RES. For those of our listeners who don't know about this, can you tell us about the importance of your work concerning RES?
For sure. So I'm the director of the Workforce Race Equality Standard implementation team in NHS England, NHS Improvement. And what that is it's a unique program which looks at the difference in experience of black and ethnic minority staff and white staff in our NHS. So across the whole of the English NHS, we do something called the staff survey every year. And we ask questions of all the staff, so black staff, white staff, Asians, everybody across the board. We ask these questions. And we ask 9 questions, 4 of them from the staff survey, and 3 of them we get through the staff record. So we ask questions about, for example, are you going to be appointed following shortlisting? Are you, for example, likely to go through the formal disciplinary processes? We ask about bullying and harassment. We ask about patients bullying and harassing you. We ask about staff bullying and harassing you. We ask about your managers bullying and harassing you. So we get that data, and we've got that over the last 5 years. And you won't be surprised to know that our black, Asian, and minority ethnic colleagues have a poorer experience of working in the NHS than white colleagues. So that's what we do. And when we get that data, our job is then to start closing the gap on the fact that white people and black, Asian, and minority ethnic people have different experiences. So we're trying to make the experiences good experiences for everybody. That's it in a nutshell.
I mean, Yvonne, how many people, do you gauge the percentage of people who actually respond to this data that you're looking for?
Do you know what? It is really very, very good because we've got about 250 provider organizations in the country. So that's hospitals and community organizations, mental health trusts and so on. And we usually have 100%, all of the organizations send us back their data. So we have 1.4 million people working in our NHS, and we have usually about between 46 and 50%. It's getting better, but that's still a substantial number of people that will be responding to the staff survey. But more than that, for indicators where we're just looking at things like shortlisting and disciplinaries and so on, we have access to what we call the electronic staff record. So we can we cover practically all of the NHS with those questions.
And these surveys, they're anonymous or people?
All anonymous. All anonymous. So all organisations ask their staff to fill in the forms. And what we've been doing year on year is cranking up and saying to our black, Asian, and minority ethnic staff, you must fill this in, because the more you fill these forms in, the better it will be for us in terms of getting the information and the data that we need and we want. And it's interesting because it is rising, and more people are filling it in, because I think to begin with, people believed that they'd be identified. Yep. And if they said anything negative, it would be awful and it'd come back on them.
That's right.
And I think they're finding now that it's not like that. So we're really happy with the numbers of people that are actually filling in the forms and the quality of the data that we're getting, so we can make some really clear decisions and statements about what we think is going on in our NHS.
Now, with the results that you have, what is it that the NHS is doing to tackle this race inequality, or challenging, as I always say, challenging the glass ceiling in the NHS workforce?
I know it's awful. So what we know is that we have 1.4 million people working in our NHS. And of that 1.4 million, you probably will be shocked to know that we have 10 executive directors of nursing only, and that's out of a nursing workforce of 600,000. We have 44% of our doctors from black, Asian, and minority ethnic backgrounds, yet we only have 37 across the whole of the country. Directors, medical directors, chief executives, those are the people who make the decisions at the very top of organizations and so on. We only have 8 of those from black, Asian, and minority ethnic backgrounds. So you can see that there is a glass ceiling.
Yes.
So the job is to get people to understand that we're living in a diverse society, whether people like that or not. It is as it is, and it's not going to change anytime soon. That a lot of people have worked incredibly hard. They're very committed. In fact, the NHS would not be what it is today without Black and minority ethnic staff working in it and making sure that patients get high quality care. So it's only fair and right and equitable that everybody has access to, become the best that they can be and actually go up the ladder. And so the work that we do, not only do we put out the data and make sure that everybody understands and knows it, we talk to organizations about making the changes that need to be made in order for everybody to have a fair and equitable experience in the NHS. And I suppose that is an easy thing to say, but what we've had to do is to build our work into what we call the system levers. So the NHS works very much on process. And so we've had to build the work that we do into the standard contract, so organizations know that they have to collect this data and they have to pay attention to it. We work with the Care Quality Commission, so when organizations are being assessed by the Care Quality Commission, it's the CQC for short, they pay attention to the experiences of our Black and ethnic minority staff. And it matters because if they don't pay attention to it, then technically they shouldn't get graded as an outstanding organization or a good organization and so on. We're trying to turn the screw on that a bit more to make it a little bit more robust. But building these, the work that we do into the system levers mean that organizations have to pay attention to this. It's not just I think I'll do it today and maybe not tomorrow. It's something that organizations are doing because they must pay attention to it.
I mean, Yvonne, I'll be honest with you. I worked in the housing industry for 20 years and it kind of, the BAME contribution to the housing industry is exactly the same as it is in the NHS. Yeah. Yet the glass ceiling, that's where I learnt the word glass ceiling. That, I'm going back 20 years. We were told openly, don't challenge it. This is what you'll get to. My question is this generation, we're in 2020 and we're talking about glass ceilings. Is it different for this younger generation? Do they actually, we're talking statistics, we're talking data, but and theories. Is there a change? Has there been a change for this generation of BAME youngsters who are doing fantastic work in NHS?
I know. Do you know what? I totally hear that, and I guess it's a really difficult question to answer because I always have my glass is always half full. You might say it's half empty, but my wish and my hope is that the work that we're doing now, which is very different to any of the work that we've ever done before. I'm an old girl now, and I was in this country back in the day. I grew up in Bristol, and back in those days, you used to hear no dogs, no blacks, no Irish, and you'd actually see. And I'd see those signs. My mother used to take me shopping, and I'd see those signs on people's houses. Back then you used to have programs like Love Thy Neighbour, and it was all right to call people all sorts of horrible and unpleasant names. We don't have that now. It's very unusual that you actually walk down the street and somebody calls you names or you see these signs there. Mm-hmm. But the structures and the systems that have been built into this country over generations are very, very, very difficult shift. And you will know, because we've all been through the last 6 or 7 years, where we've had this hostile environment, which was approved by people in high-level positions. We've had, the Brexit debacle, let's call it that, over the last few years. And so there are elements within our society which want things to go back to the way they were 50, 100 years ago. And those people have loud voices. Our youngsters are much better at actually integrating and being with each other and talking to each other and hanging out with each other, and they do stuff online internationally and all of that kind of thing. And my sense is that they're not going to tolerate what people like me and my generation tolerated. They don't want that anymore.
Well, we were told to tolerate it by our own parents.
We were told to shut up.
Exactly. We were told that's the system. Follow it.
Our kids are not like that, though. The kids nowadays are much more. I have 3 sons myself, and they're all grown up now, but they're more questioning, and they are much more curious about things, and can't understand why they are British. They were born here. Their parents, some of their parents were born here. Why is it that we can't have the same, respect? Why can't we have the same experiences? Why can't we have the same opportunities as our white counterparts? And they're not going to tolerate it. So my sense and my feeling is that it will improve, because it has to improve. And as of yesterday, when the data came out, the Office of National Statistics came out with the data, and it actually showed us all that, people from Black, Asian and minority ethnic backgrounds were actually more likely to die of COVID than their white counterparts. All of these things are playing into the minds of our young people, and they're questioning that. Well, why is that? And what is it that we need to do as a society to make things different and better for all of us? So I think there will be a change. It's not going to change overnight. It's not going to change overnight. But I'm hoping, as a consequence of what's going on now, people are going to sit back and think we need to do something with our society, and that something needs to be very different.
Now, you mentioned politics. Without politics, nothing can happen. I mean, nothing can go forward. I mean, that's the harsh reality of it. So how much backing or how much positivity have you received from the decision makers? I should put it that way.
So I have to be honest and say that NHS England, the organisation that I work for, the senior leadership have been completely switched on to this agenda.
Awesome.
The chief executive is a chap called Simon Stevens, and as a consequence of Simon's commitment to the work that I'm doing, we have been able to move things forward. That isn't to say that everybody in the NHS is happy with the work that we were doing at the very beginning, because there was a lot of pushback. When you're working on race,
of course,
you will know
it's
that
sensitive.
You always get a lot of pushback. And he actually said, no, this is something that we have to do. He committed to doing it. He put money behind it. I have a team. That team is completely, it's what they call a team that's getting substantive money. So that means that it's not just seed funding, which might disappear tomorrow or the next day. It's built into the NHS financial regime. So each year, the work on race is guaranteed that money. So we don't have to worry about, because usually back in the day, what used to happen was they'd give us a little bit of money, you do a program, and then there's no more money for it, and the program stops, and you go backwards again. We're not in that situation now. This thing that I'm talking about has been built into the long-term plan. Now, the long-term plan is a strategy that the NHS has developed for the next 10 years. It's being built into the new people plan within the NHS, which hasn't been published yet, but will probably post-COVID. So the senior leadership in the NHS has been very, very committed to this. And I will say this, even though I'm not supposed to be talking politics, the last administration, when Theresa May was the Prime Minister, actually took a lot of interest in race equality, and she was instrumental in putting together and developing the Race Disparity Unit. And the Race Disparity Unit, and you can go online and look that one up, because what it does is it gives lots and lots of data and information about health, housing, education, social care, and Black and ethnic minority people's experiences of that. So they actually did quite a lot of work around just finding out what our lives were like and what our experiences are. And Simon Stevens, their chief executive, is talking now about having a Health and Race Observatory, a repository of best practice specifically looking at the lives of Black and ethnic minority people and how we can improve them through health. So I would say that it's been better than it has been in the past. There's been more attention paid to it than there has in the past. It's not enough. It's not enough. But I can't in all truth say it has been really poor.
Yvonne, you talked about NHS. Is there an element of care which is part and parcel of NHS, or is that separate entity?
No, well, the NHS is care, but you're talking about social care.
That's right.
So
yes.
it's called the Department of Health and Social Care, and health is one element of it, and social care is the other element of it. And I always think that it's a really false and terrible divide, because I remember when I was a nurse, we always used to talk about the grey and wavy line. Is this a health bath? Or is this a social care bath?
Yes.
And actually, they're one and the same if you think about it. So if it's a health bath, the district nurse would go in and look after the patient and do what they had to do. And if it was a social care bath, then you would have to get care workers going in. And of course, the money would have to come out of their budgets. The budgets are split. So there's a health budget and there's a social care budget. And you will know that the health budget is much healthier, much bigger than the social care budget. My sense and my feeling is that needs to come together. It needs to be, we need to look at people's health and social care in the round, because it's a really arbitrary and really tricky thing to divide the two. Really.
Well, that's why I asked the question, because unless both of them are hand in hand, we will kind of go around in a circle.
Yes, I agree. I agree with you, and I think that's why I think we now have, because we used to have the Department of Health, and social care was over there somewhere, and it's now the Department of Health and Social Care. And I think that what we're trying to do is to bring health and social care closer and closer and closer together, so that eventually we will have a system that looks at people's needs in the round. Because as you get older, your health and your social well-being are so inextricably linked. It makes it really, really difficult to separate off the two and decide whether you need a health bath or a social care bath, when it's actually bath that you need.
Really fascinating stuff, Yvonne, and I love the aspects about the structures, that it all needs to change, and all these system levers that you mentioned as well. I mean, okay, you mentioned it as well. You can see this in other institutions as well. When you look at the transport institution, when you look at our police force, I mean, these institutions have inequalities in them, especially when it comes to the BAME community.
Absolutely.
And when you talk about that glass ceiling, you can make these comparisons, can't you? So easily.
Yes. I mean, yes, you can. And looking across the board. And I always say, the thing that we're dealing with in terms of how Black, Asian and minority ethnic people are treated is not just an NHS issue. It's not even just a British issue. It's a global issue. If you go to places like Australia, New Zealand, America, Canada, you will see the same phenomena. And in white-dominated countries, you get exactly the same issue, tweaks and little bit, nuances here and there, but mostly it's the same thing, where people from Black, Asian and minority ethnic backgrounds have a poorer experience of living in those countries and working in those countries than their white counterparts. So it's something that has developed over many, many, many years globally, in terms of how people are perceived, how people are acknowledged, and how people are treated. And I think that, unpicking that out of people's minds and their brains is going to take, more than 2 or 3 years. It's going to take time.
Sure. I mean, I really welcomed when Keir Starmer appointed Doreen Lawrence to look at...
I was waiting for Hanif to mention Keir Starmer.
I know we are a little bit biased, obviously, but we know Baroness Doreen Lawrence, her life story and what happened, and she is such a wonderful activist in this, and she's been obviously appointed to look at this scenario, and I'm sure her remit will go much wider than just looking at this disproportionate effectiveness of the BAME community with COVID-19. I just wanted to change tact a little bit more, and I'm sure Guillaume wants to come back in as well again later. But you know, when we talk about the NHS and we were discussing about it being a charity, there's always a charity that's associated with it. But do you think that the charity money that's there to provide the services to the British people is the way forward? Should actually the NHS be funded from the purse of the government rather than these charitable organisations?
Right. So the NHS gets 121 billion pounds from the public purse. I mean, it gets that's a phenomenal amount of money at the moment, and there is a commitment for that to rise. So 121 billion is not an insubstantial amount of money, and that's where we are at the moment. In terms of charities, all organisations across the NHS belong to an umbrella charity, and I know this because I had a conversation with the chief executive of the NHS charities the other day about the amount of money that has been raised through COVID to support NHS staff, and that money is quite a lot of money that's been raised. I mean, I'm quite surprised that it's in the millions, the amount of money that's been raised, and what it's been raised for is specifically to support NHS staff at the moment. So if you're a member of staff in the NHS and you're going through a hard time, you can access that fund, and that can help support you. What it doesn't do is pay for services. It doesn't pay for, if you need if you want to have an X-ray or whatever it is, or pay for going on and having an operation or whatever it is. It doesn't do that. So the NHS charities are paying at the moment for staff. So a staff room, or if staff need some money for whatever it is, they can access that money. So and I think this is the question, is whether or not there should be money, I suppose, funded. The work for the NHS should be funded by people putting money towards it. Is that where we're going with that question?
Yes,
yeah.
I mean, NHS. I mean, some people might be thinking NHS has become a charity, the way people are raising funds for it. But I'm so happy that you kind of clarified what the money is being raised for, and the question is, should this be happening? I mean, isn't this the responsibility of the government?
Well, do you know what? I think over this COVID period, and you'll have seen this yourself, the nation has come together, and thankfully they're really delighted and happy with the work of the NHS. And I think there's a recognition that the work that people do in the NHS, whether you're a nurse or a doctor or a cleaner or a cook or a porter, is really important frontline work. And I think the country itself have wanted to contribute to supporting health workers, because you will know that for many years, nurses have had to bang the drum and ask for more money. Doctors have been out on strike. People have it's not been easy for people who are working in the health service to get, a living wage for some of the workers, and people have really and truly stepped up to the plate and said, our NHS workers are important. We believe in them. We believe in what they're doing in really difficult circumstances, and we want to contribute to actually making them recognise and realise how valuable they are to us. So let's put some money in, and people have been putting some serious amounts of money in. I mean, you will have seen Captain Tom, Colonel Tom, as is now. He was 100 last week. I mean, he made £30 million, which has gone into the NHS Charities Fund, which will be to make sure that staff are okay. And I was talking to the chief executive, and she told me that each organisation across the NHS, for a starter, got £35,000. Each organisation got £35,000 to spend on their staff, to make sure that their staff actually were having, decent breaks and decent food and decent places to sit and relax and all that kind of thing, which I think is fantastic. I think that's really great.
Yeah, that's why he's been recommended to be on the honours list, hasn't he? So, well deservedly.
Has he?
Yeah.
Has he?
Yeah.
Oh, right, okay.
Yeah, the Express had launched the campaign, and when you look at their papers, they say that he's made the shortlist. So over 91% people that they asked said yes, overwhelmingly he should get it. So.
Well, you know what? To be honest with you, if I was 100 and I could walk around my garden as much as he did, I would count myself a very lucky woman. I mean, you have to admit it's pretty spectacular, wasn't it? And that's good. And the fact that he made, the money that he made, and it's gone to the NHS and it's going to NHS staff is also a good thing. But if the question is, should we put our hands in our pockets again to actually fund the NHS? To do services and all the rest of it. We already do that through our taxes, don't we? I mean, we as a country, we already do that. So at the moment, that's not happening, but who knows what will happen in future.
I'm going to have to cut it off here because all of them, they're going to keep asking you questions, Yvonne, but I'm going to let you go. I know there's more things that you have to do. So thank you very much for your time. It was great to have you on.
Welcome. I'm more than happy to come back another time. So thank you for having me.
Right. We'll hold you to that. Tech Man, did you record that?
Bye-bye.
All right,
Bye-bye.
Take care.
Peace be with you.